So in this video, we're going to talk about C1 shear mobilization, or combined side bend and rotation mobilization. So we're going to have our clients lying on their side. We've assessed which side doesn't want to move. So in this case, the right side, C1, transverse process, does not want to shear down to the left or down towards the table, okay? In this case also, the right side does not want to shear down, so typically right side bending would be limited because that transverse process needs to shear left in order for the head to side bend right, okay? Important thing to kind of think about when you're deciding where you want to mobilize. Okay, so in order to mobilize C1, I have her head on the half foam roll, basically to block the occiput, or the cranium, not the occiput, the cranium from moving, okay? And then I can get on C1 here, okay, to shear it down, all right? It's not a perfect block because you're also going to get mid and lower cervical motion, but because your intention is that you've blocked from above, then you can shear C1, and most of that motion is going to come at that joint. Okay, so I'm going to show this with the foam roll and then also with a hand cradle kind of technique to where you can get it a little bit more localized. Okay, so with the hand cradle, or with the foam roll, I have, again, foam roll, blocking cranium. And now, in order to find C1, I find mastoid process right behind her ear, and then I come inferomedial to that mastoid process. Again, so mastoid process right here. You can actually see where I've been touching her C1 because it's red. And then I would just sink in until I find something bony, and it is right there. Okay, if I go forward, I kind of fall off. And so if I come back just a little bit right there, I'm on her C1, transverse process, okay? So from here, I could have her just do little chin nods down, okay? That would be kind of the least aggressive way to go about doing this. All right, so as she nods down, it engages my thumb, and as she releases the nod, it relaxes a little bit. I very rarely only do that, okay? That's a part of combination of other things. With this, oftentimes, that shear's been there for a while with a lot of our clients, and we need to get a bit more aggressive. Again, we don't want to flare people up. We want to engage the infill an appropriate amount to get the hopeful release or springiness that we want, okay? So I'm on C1. I'm also going to see if I can localize through her arm here. If they have a lot of neural tension, your arm okay there, Kelsey? If they have a lot of neural tension, you might not do this. But let's say I'm here and then don't let me move you here. And I want to see, does that bring tension into my fingers? It does. Okay, so that's a good option that I could do. Nod your chin down, hold that nod, and then hold there. Good, I get an even better infill there. I could see if I rotate her trunk down towards the table, so chest down towards the table, right there gives me a little bit of harder infill versus rotate your chest up towards the ceiling. That kind of loosens things up a little bit. So if we do chest down towards the table, there, and then I add in the same thing here. Keep your chin nod there just a little bit. There we go, breathe in there. So now I feel like I have her localized decently well to work on C1 in this position. The only other thing that I would check potentially is raising your feet up towards the ceiling. That produces kind of a basking seal type motion as an option. That doesn't do much for me here. I could also check a little neural tension, where if she straightens her leg out, I want to see, is neural tension driving this C1 dysfunction into a shear? If you localize that infill and now straighten your knee out again, I just want to see, is there a pulling up into my fingers at all? Is there increased tension? And there's not a lot of increased tension there. So these are just kind of some options that you can play around with in this position. Now, secondarily, if I want to get a little bit more aggressive directly onto C1, I could come in and I could either just hold her head here with my hand and get onto C1 and localize there, or I could come and actually cradle her head where my fingers are right underneath her mandible, just softly supporting. And then she is resting, her cranium is resting on my forearm, and I'm kind of connecting my bicep in to the top of the cranium. And then from here, I can get back onto C1. I can shear her down towards the table, side bend her back towards me, and then check rotation to localize. But again, it's a shear emphasis, and I'm just three-dimensionally winding her up. And now I could have her tuck her chin down a little bit. And so that engages that infield. I could have her, again, I could have her do any neural tensiony type motion, straightening the leg out, raising her feet up into basking seal. I could have her do a little trunk rotation forward and back, all while I have, go ahead and lie back on your back, all while I have her infield localized just to see what winds it up more. Okay, so that's two options for mobilizing C1 inside lying, one with the half foam roll, the other with the cradle grip.